Nicole Goyle, and I am here with my husband, Dr. Ashu Goyle. He is our pain and regenerative medicine physician at Integrated Spine Pain and Wellness. I do all of our aesthetic procedures and also lifestyle management. Our goal with these series is to talk about different pain procedures and different pain conditions that people might be experiencing in order to help them heal their pain and get back to living a better way of life. So today's topic that we want to discuss is radiofrequency ablation. So the question is for Dr. Goyle, what exactly is radiofrequency ablation, and how can it benefit people who are suffering from chronic pain?
Great. So radiofrequency ablation is a modality we use in pain management. It's actually used in multiple specialties for different types of treatment. But specifically in pain management, we use radiofrequency ablations to treat chronic back pain, mid-back pain, neck pain, knee pain, and other types of chronic pain conditions. What we do is we use radiofrequency energy to create heat. This heat destroys the outer layer of these nerves, whatever part of the body we're treating, and it effectively disrupts the communication of this nerve between the painful area and the brain. So ideally, these treatments can provide relief for 6 months to a year. They're not permanent, but the nerves regenerate, and when they regenerate, the pain signals are regenerated as well. So the most common application for radiofrequency ablation in pain management is for chronic back pain, chronic thoracic pain, or chronic neck pain. So typically we use this to treat pain that does not radiate. So not sciatic pain, the pain that is localized to the low back. We typically describe this as arthritic pain. So pain that is worse upon awakening, pain that is worse with prolonged sitting, prolonged standing, extension usually tends to worsen this type of pain. So when people have gone through physical therapy, tried anti-inflammatories and muscle relaxers, and they're just not getting the relief they want or need, then the first step that we do as pain specialists is we do a diagnostic nerve block. So this block is done under local anesthesia. Patients are usually awake for this. We use X-ray guidance to use a tiny needle to deliver anesthetic or numbing medicine to tiny nerves in the spine or the knee or whatever area we're trying to diagnose. And the point of this nerve block is it's diagnostic. So we want to determine if this is where the pain is coming from. And if we treat these nerves, does the patient have a likelihood of getting a good response and longer term relief? So we do a diagnostic block. What we're looking for is at least 50 to 80% improvement in their pain for at least the duration of the local anesthetics. So the local anesthetics that are typically used last anywhere from 2 hours up to 8 hours. So during that time, so after the block, we look for pain relief. So we send patients home with a pain diary, tell them to go be active. This is not the kind of procedure where you get the nerve blocks done and you sit at home and wait for it to do something. These usually take effect within 20 to 30 minutes, sometimes longest maybe an hour. And then patients are advised to go be active, do the things that normally cause their pain. For example, if it's prolonged sitting, we'll sit and watch a movie and see if you're able to do that. For some people, it's walking through Costco, going grocery shopping. So I encourage patients to go out and do these activities and see if their pain is substantially reduced during the 6 to 8 hour window. So they'll record their results on a pain diary. They follow up with me, bring that information in, and we review it together. There's a substantial reduction, and that would be considered a positive response. We typically have to repeat the diagnostic blocks. Insurance companies require us to do this for most of these procedures, at least in the spine. And so if we have another positive response, the patient can come back in for a slightly more invasive procedure, still minimally invasive. A lot of my patients do this without any sedation, just under local anesthesia. So this is not a surgical procedure. Takes 15 minutes to do this in the office. But what we can do is instead of just deadening the nerve, we use a needle to locate the nerve and then use a radiofrequency probe that's connected to a radiofrequency machine that generates these vibrations that create heat that destroy the nerves. And so that procedure takes 15 minutes. It can take anywhere from 3 days up to maybe 2 to 3 weeks before the patients realize full results. And then the relief can last for 6 months to a year, sometimes longer. And then during that time, I encourage people to do physical therapy, really practice an active and healthy lifestyle. So when the nerves regenerate. Ideally, the pain doesn't come back to the point it was before. Okay. So that's typical for back pain. We can also use this procedure for treating persistent knee pain. Okay. So patients who have osteoarthritis, who've undergone injections, physical therapy, hyaluronic acid injections, which are the gel injections, and who aren't a candidate for surgery may be a candidate for radiofrequency ablation of the knees, of the nerves that innervate the knee. Okay. And that's done the same way. We do a diagnostic procedure where I block the nerves, see if the pain gets substantially better for 6 to 8 hours. And if it does, the patient may be a good candidate for ablation of those nerves as well. Okay. We also use this radiofrequency ablation technique for patients who have had knee replacements and who have persistent pain after knee replacement. Unfortunately, not all knee replacements provide pain relief. Okay. And so those are the patients I typically see, the ones who didn't do well after a knee replacement. Okay. And as long as there's no hardware failure, no mechanical issues, then this is something that we can offer patients.
Got it. And so I know you touched on it, but what are some of the symptoms that a patient might experience? You know, do they need, if somebody is dealing with chronic pain, is this something that they need to go through different procedures before they are a candidate for radiofrequency ablation? Great
question. It just depends on what kind of pain they come in with. For example, if someone comes in with sciatic pain and back pain, the goal is to get the sciatic pain out of the leg, the pain out of the leg, because that's more of a nerve issue. Okay, so that's a nerve root issue. So that's a little more critical of a situation. So we want to reduce that pain. Once the patient has gone through those type of procedures or has recovered from pain in the leg, sciatic pain, or pain in the arm, then they may be a candidate for these ablation procedures. So typically after people have gone through physical therapy, have tried more conservative treatment, and if they fail all those, then we can offer medial branch nerve blocks and radiofrequency ablation.
And as we've touched on in past videos, chronic pain is considered any pain that lasts 3 months or longer, correct?
Well, yeah, any pain that lasts longer than the anticipated healing of that injury.
Got it. Okay, so if they're experiencing chronic pain symptoms, they come in to see you, you do a thorough evaluation, and then determine if they're a candidate for radiofrequency ablation or not.
That's correct.
Okay, wonderful. And then I know you did touch as far as if it is a painful procedure. You said most of your patients don't require any sedation or...
Yeah, for this procedure, usually the worst part is a local anesthetic. Okay. So there's a sharp pinch, pressure, and burning with each injection. And with these radiofrequency ablation procedures, we're typically doing anywhere from 3 to 4 sites at a time. Okay. So, that's the most uncomfortable part. Okay. For the rest of it, needle position can sometimes be uncomfortable. When we get to the deeper structures. But once the needles are in place, we do testing to make sure that we are where we want to be and not where we don't want to be. Okay. And once that part is done, that's not a painful part of the procedure either. We use a powerful local anesthetic to deaden the nerves before we do the ablation. The ablation without anesthesia could be very uncomfortable. Okay. Yeah.
And when you are doing this procedure, is everything guided by X-ray?
Oh yes, for sure. Okay. Yeah. So all of our spine procedures are fluoroscopic guided or X-ray guided. Okay. So we can see exactly where the needle tip is at all times. Okay.
And then what are some of the symptoms that people might experience after the procedure? I know you said that you like your patients to be active, but when they leave, when they walk out of your office, are they going to be in pain? Are they going to see a reduction of pain?
Oh, that's a great question. So immediately after the procedure, most people feel better from the local anesthetic. Okay. That tends to wear off in a day or so. Okay. And then there may be soreness from the needles at the injection sites and sometimes deep in the muscles also. But that lasts just a few days. Okay. So yeah, I'd say 99% of my patients who undergo radiofrequency ablation require nothing other than Tylenol, Advil, or muscle relaxers. Okay.
And then is this treatment covered by insurance?
Yes, it is. Okay. So all the major insurance carriers cover this procedure, provided that the diagnostic blocks and the diagnostic criteria have been met, and Medicare does also. Okay. For the knee, most private insurance do not cover this because insurance carriers consider it experimental, although it's been around for 10 plus years and has there's a lot of data to support its efficacy. It is covered by Medicare though.
Okay, wonderful. And then as far as follow-ups go, when a person, if they go home, they find relief with the treatment, Then when do they come back and see you after you do the
ablation.
The ablation?
Yeah, so typically I do a 4-week follow-up because for some patients it can take up to 4 weeks before they realize benefits. So
Okay.
unless there is an urgent need to be seen sooner, I usually schedule a 4-week follow-up after the ablation is completed, and then just reevaluate.
Okay.
And then we decide then if there's any further treatments that need to be done, or if the patients are ready to go back to physical therapy.
Okay.
And then they'll follow up with me at 3 months and then maybe 6 months.
Okay. Wonderful. Well, I feel like we have received a lot of great information, and I think you've answered our questions, well, my questions, in a very articulate and thorough manner. So stay tuned for segments in the future where we will be discussing more chronic pain and regenerative medicine topics.